Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Functional Communication Profile assesses an individual's communication skills across various modalities, including verbal, nonverbal, and written communication. It evaluates parameters such as comprehension, expression, social interaction, and use of alternative communication methods in cases of speech or language impairments. The main purpose of the Functional Communication Profile is to identify communication strengths and deficits to inform the development of targeted intervention plans. It aids clinicians in managing conditions such as aphasia, cerebral palsy, developmental delays, and traumatic brain injury. The assessment provides a comprehensive profile that guides therapy goals and monitors progress over time. The Functional Communication Profile is indicated for patients with communication impairments resulting from neurological conditions such as stroke, traumatic brain injury, or dementia. It is particularly useful for adults exhibiting varied levels of language and cognitive deficits. The profile facilitates assessment of functional communication abilities across multiple modalities, including verbal, nonverbal, and written communication. Clinical contexts involving rehabilitation, long-term care, and communication therapy benefit from its use. Empirical studies demonstrate its effectiveness in capturing communication performance in naturalistic settings, enabling targeted intervention planning. The Functional Communication Profile consists of 176 items designed to assess communication skills across 8 domains, including cognitive, speech, syntax, semantics, and social communication. Each item is scored using a 7-point ordinal scale ranging from 0 to 6, where higher scores indicate greater communication ability. The clinician begins by observing or interviewing the individual to gather data on everyday communication behaviors. Responses are recorded based on direct observation, informant report, or a combination of both. After scoring all items, raw scores for each domain are totaled and compared against established normative reference values stratified by age groups. Scores falling below the 5th percentile suggest significant communication deficits, whereas scores between the 5th and 25th percentile indicate mild to moderate impairments. Scores above the 25th percentile typically fall within functional communication levels. Clinicians use these results to identify specific areas of communication weakness and to develop targeted intervention plans. Sensitivity refers to the ability of the Functional Communication Profile to correctly identify individuals who truly have communication impairments. Specificity indicates the tool's ability to correctly identify those without such impairments. According to validation studies, the Functional Communication Profile demonstrates a sensitivity of approximately 0.85, meaning it accurately detects 85% of patients with communication difficulties. Its specificity is estimated at 0.8, indicating it correctly classifies 80% of individuals without impairments. For instance, in a clinical setting, if 100 patients have communication deficits, the Functional Communication Profile will correctly identify 85 of them, while among 100 individuals without deficits, it will correctly exclude 80 as unimpacted. These metrics suggest that the Functional Communication Profile is a reliable instrument for distinguishing between affected and unaffected populations in speech and language assessment contexts. The functional communication profile was developed in the early 1970s by Lapointe and colleagues as an observational assessment tool designed to measure the communicative abilities of individuals with severe communication impairments. Its initial validation involved a sample of individuals with diverse neurogenic communication disorders, demonstrating high inter-rater reliability with coefficients above 0.9 and test-retest reliability exceeding 0.85. Subsequent studies have supported the construct validity of the profile by correlating scores with established language measures and functional communication outcomes. Additionally, research has shown that the instrument is sensitive to changes over time, making it suitable for monitoring progress in therapeutic interventions. While some contemporary evaluations have called for further standardization and norm development, the accumulated empirical evidence over the past 5 decades confirms the functional communication profile's utility and scientific grounding in both clinical and research settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.